All right, I'm live on my second platform. Hello, this is Stephanie Mitchell here for PC 729. This is a health policy reflection. During this time, I was able to listen to quite a few presentations about social justice from Olive & Oak team on maternal mortality, birth inequities. What they found is the same thing that we've been screaming as birth providers for a while now, is that we're doing worse than a lot of countries that we share equitable resources. So places like the UK and Canada, we're doing worse. We're on par with countries in sub-Saharan Africa for certain populations. Throughout every single one of these presentations, what was highlighted is that the victim, the ones who are affected most disproportionately, are Black women. That's what each one of these presentations allowed me to see. When we talk about epidemiology, 700 to 900 maternal deaths per year. It's 3 times the amount of recommended from Healthy People 2020. And the area that is doing the worst are southern parts of the United States, where there are disproportionate, they're doing the worst. States that have higher African-American populations and increased burden of care. It's overwhelming when you really think about it. The maternal care costs billions, and southern states are doing the worst. Alabama, Mississippi, Florida, Kentucky. It's disgusting, is what it is. As I went on to listen to the rest of the presentations, it became very clear to me that not only are we in crisis mode, but we are now in the planning modes of how to get things better. And I liked how solutions were offered for each one of these presentations. Dr. Neil Shaw spoke of guidelines from the World Health Organization and about what these numbers of disparities was showing. And what it showed was that if you put it in simple terms, Black women aren't listened to. They aren't listened to. He says, yes, it's an uncomfortable thing to talk about, but we know this. So where do we go from here? From these presentations, I saw that every single disadvantage, every single determinant of health was shared by Black women. Implicit bias, barriers, policy that had where women had difficulty obtaining access. For example, there was a presentation about expedited partner therapy, and another one about Title X clinics and access to contraception. But all of these things, when you pile on the added layer of racial disparity, you end up in a crisis zone. The presentation brought out, thankfully, that we have a group of providers who and people and everyone who touches women from any portion of healthcare who have access to women are sort of now getting to the point of, okay, what do we do now? What are we supposed to do? And it was very nice how, you have people like Serena Williams, people who more recently like Beyonce Knowles, who are bringing these things to light, which show some really scary things, that it doesn't matter. It doesn't matter if you're rich. It doesn't matter if you're have access. It doesn't matter if, you have wherewithal or good connections. It doesn't matter. If you're a Black woman in this country, there are some really scary things that can happen to you just based on some of these things. Okay, so I liked the part that brought out and brought names to the light of this crisis that we're in. So yes, it started with the Serena Williams and more recently Beyonce, but Kira Johnson, a victim. Ty Hardin Moore, a victim. It's my friends, it's my neighbors, my sister, my daughters. Shalon Irving, I think it's Sabini Buchu. I don't really know if I messed up the names, but I do that all the time. But these are people. These are real human people that this is happening to. Recently, LaShonda Hazard, and in the interest of full disclosure, that particular maternal death, when there's 700 to 900 a year, that one just happened to land on the doorsteps of where I worked at my hospital. And what this entire course, this entire discussion, these entire presentations about social justice and health equity have shown me is that as advanced practitioners, as a midwife, as a Black woman, we have work to do. And I am going to use whatever platform I find necessary to try to push that agenda. It's something that needs to happen. And I am going to call to action Elizabeth Koblenz. Remember, like I said before, sometimes I messed up on names, but you know who I'm talking to. Y'all know who I'm talking to. So sorry in advance. Amanda Huber, Sandra Meller, Allison Nass, Gay Wise. I'm talking to you guys. I'm talking to every last one of you. Linda Flowers, Victoria Ramsey, Bethel Renfro, Erin Safik. I know I messed that up, but you know who you are. Cindy Conway, Sarah DeLong, Yvonne Holtz, Kizzy Sai. Might have messed that up, but Kizzy, right? Bree Farron. Bree Farron does things showing she's an ally. She doesn't need to talk. She does the things as a provider. Okay. These are the things that I'm looking for. Ruby Greer. Hi, girl. I see you. I hope you have a good birth. Christina Isnardi. I still haven't Googled you, but I will. Okay. Dr. Victoria Baker. I'm calling you to action. Dr. Komorowski, I'm calling you to action. We know this is a problem. We know that we have the ability to help. We know that this is going on, and I'm calling you to action. Every last one of you, and I saw it in these presentations, and I'm pumped. I know it's happening. And just to make sure I hit on the last little point that I needed to, yes, as a social justice leader, how does the content and the analysis shape up the way that you communicate with others? I think I'm learning to be more straightforward. That's what I'm doing. I'm learning to be more straightforward. All right. If I see someone that is, maybe they're being unfair, what I've recently been doing is saying, hey, guess what? When you get admitted to the hospital, I don't care about really too much of all of these. This is what I care about. I care about that you are listened to. I care that you are respected. I care that you are heard. And here is my cell phone number. And if those criteria aren't met, you call me. And so when I pick up my phone and my patient is in the emergency room and the nurse is standing there at her side and she hears that the midwife is on the line, well, suddenly things change. Suddenly it's, let me explain your options. Okay, so I feel like my voice in that is using some of that privilege that I will admit that I have being as a midwife working in a hospital. I'm not saying I'm level, and I'm not thinking I'm level yet, because I know there's a lot of other barriers that I face, right? But what I will say is that I'm going to use my ability to speak up for women. And I'm hoping y'all do the same. I'm hoping you guys do the same. And then one last thing, because I'll make sure that I hit all the points that I was supposed to. How does it feel to apply a population perspective to this problem to your own agency or your own practice? I don't think I need to answer that. And I'm not going to. I think you have the answer to that one. How can you help increase awareness of healthcare disparities or the issues around vulnerable populations specific to your agency, clinical, or community for you, your colleagues, or your patients? I mean, I feel like I've said that. A million, zillion, gazillion times. But if I can be any clearer, I'm going to be calling you to the rug. I'm going to be calling you out. I'm going to expect that you're giving the best care that you are supposed to be, okay? In whatever avenue that it is that you work at, I'm going to be expecting that, okay? And I think other people in positions are going to be expecting that too. You got to call it out. You have to say the words that you see. That's how. All right. So anyway, let's see. I hope I answered that. The other thing that I wanted to say is sometimes I did get a question. Well, sometimes why, do you have to say the F-bomb? It's not for lack or inability to reach for my ample vocabulary. Okay. But sometimes the situation is just fucked up. Okay. There's no other words for it. Okay. It's fucked up. All right. Thank you for listening to that. I'm going to end this live stream and I'm going to come back to y'all. And we'll save that. Are you sure you want to end? I'm sure y'all want it to end.